Hey guys, my name is Autumn and I'm doing an independent surrogacy. If you are new here, there is two ways you can do a surrogacy. There is an agency or independent route, and we are doing an independent route. We are not working with a surrogate, or we are not working with an agency for our surrogacy. So we're having to figure everything out on our own. There is no middleman, and we've come across a few roadblocks that we were not expecting, and we did not know how to get through them, and then we ended up getting through them. And I'm just kind of here to help you figure it out and help you know what to expect, because there isn't a lot of information out there, and it kind of irritated me not knowing the way and what to expect. So I'm kind of here to help you. And so the last time I left you, we had received my husband's labs. We are waiting for ultrasound. We've started our labs. We do an ultrasound in 2 days. We've started labs. We've started medication. For surrogacy, you are prescribed a few different medications, and they can come in different kinds of forms. So there is oral, there's suppository, and there's injections. For many, they're prescribed suppositories or orals, and for myself, we were prescribed injections. And then there's a few other medications, but the main ones are estradiol and progesterone, and those are in the form of injections. So I've started my estradiol, and I started at 0.1 after my first set of labs. After my second set of labs, they wanted me to increase it to 0.2 mLs. So they had the medication delivered to my house. I didn't have to go to a pharmacy. The pharmacy delivered it to my house the day that I needed to start the injections. So I have a clip on how it came in, what all I got, but in just a quick summary, this is for my estradiol medication. This is 18 gauge needle, which is the withdraw needle, and then these are the 22 gauge, which is the injection needle. This is the syringe, and then these are the alcohol wipes. This is the estradiol medication. It's in a little vial because it's not supposed to see a lot of light, so I keep it in a box. Don't know if that's what you're supposed to do, but that's what I do. And then they gave me a sharps container. I've seen videos where people don't have a sharps container, so I'm very fortunate that I have that, because as you can hear, I have kids, so it's very convenient that I have that. So that's where I dispose of all of my needles. This was all delivered to my house, and so that made it very easy. So I started my injections that day. I do it every 3 days. And so yeah, that's what I'm doing with that injection so far. Ryan, stop it. Just stop it. Kids, mom life. Anyways, so I've started that injection, and the way that I have experienced it so far is it's better to go in a little bit more of the meaty area, because you're not going so deep into the muscle, and I feel like that's where a lot more of the nerves are. So in my experience, don't go so far next to the hip. You want to go a little bit over so that you have a little more cushion, so that it's not penetrating so many nerves. And also, when you do the injection, you want to aspirate a little bit so that you know that you're not hitting a blood vessel, just because I'm sure that can cause problems. I don't know what kind, but that's what they tell you to do, is make sure that you withdraw the syringe just a little bit so you know that you're not hitting blood, and then you're clear to go. What I have seen a little bit of, and I've witnessed, you want to make sure that you or your partner or your spouse or whoever is doing the injection for you, maybe your mom, you want to make sure that they are knowing what to expect, because when you do the injection, it's not the injection that really hurts, it's the medication, in my opinion. And it's not really that it hurts, it just burns, and it goes out so freaking slowly that you're sitting there for a few seconds with a very sharp needle in your body. So you want to make sure that you or the person doing your injection knows that it's going to go very slow, not to be shaky, not to be moving the syringe around, and not to be forcing the medication out, because that's going to cause the needle to move, and you don't want the needle moving inside of your body, because it can cause a lot more irritation and a lot more pain for you, because it's not supposed to be moving. It's supposed to just be like in, push the medication out. So just so you know a little bit of what you want and what to expect, and just for your knowledge, because it's not really spoken about, but I've witnessed it, so I wanted to let you guys know, because it can happen, because the medication goes out very, very, very slowly. Even with the estradiol, I didn't think it was going to go so slowly, because it's not an oil like the progesterone is. So I didn't think, oh, okay, well, you know, I'm going to have to go slow with it. You are going to have to go slow with it, because, I don't know, maybe because it's in a muscle and it's so deep. I don't know, maybe it's thicker. Who knows? But it goes very, very slowly. So just prepare yourself that you're going to be sitting there for a few seconds. You don't want to be moving around, so you're not causing more pain. Also, the slower you go, the more trauma you're causing your body, which can cause bruising. Also, don't be stabbing yourself. So you'll find your comfy medium, but just don't go too slow, because if you go slower, it's going to cause more trauma and it's going to bruise you. Also, another thing to expect, because I'm just giving you all the information I've learned so far. You can get lightheaded afterwards, and it's not cause for concern, as long as you're not hitting a blood vessel. Make sure you're not hitting a blood vessel. But I've gotten lightheaded a couple times, and I went straight to Dr. Google, because I was like, what's going on? Why am I lightheaded? I'm about to... So that's not what happened. It's just because it causes trauma to your body, and it's just your body's reaction to getting stabbed, basically. So just so you know, you can get lightheaded afterwards, and if that happens, you just want to sit down, just like you would any other time you get lightheaded. So just be aware of that. That can happen. So I'm going to show you guys how I do the injection, and where I do it at, and how it's worked out so far for me, and just so you know what to expect. But if this is helpful, keep following along, because I'm going to give you guys all the details and how everything is going for me so far. We do the ultrasound this upcoming week, so on Tuesday we're going to be doing the ultrasound. I get another round of labs and a mandatory COVID test, so all that fun stuff, and then hopefully we're doing transfer next week. So thank you for watching, and enjoy me stab myself. So this is the 18 gauge. Two alcohol wipes. 22 gauge, or whatever your smaller needle is, which can be 25 sometimes. And then the syringe. So that is what that is. And go ahead and get these open, so that you have them open when you need them. Here's the medication. I want to get that wiped off so that can dry, and the time that it takes you to do all this stuff. So then you put the thicker needle, which most of the time is the 18 gauge. Put that on here. Pick up your trash if you dropped it. And that should be dry now. Pull back air. Pull back the air for the amount that you will be withdrawing. So for me, that's 2. You probably can't see that, but that's what it is. Do this on the floor, but this is how I keep it steady enough, because it can be hard to push the needle in. So then maybe do this, put the air in, and then withdraw it. Needle back some. What I do is I pull it back a little further than my dosage, and then I push it up, because then that normally gets all the air bubbles out. Don't know if that's how you're supposed to do it, but that's how I do it. And that's a drop of drop of whatever medication. That's a drop of medication. So then you put that on there. That goes in the container, and this goes on your smaller needle, bigger gauge. So the bigger gauge, bigger the number, the smaller the needle. Put this back in the container. I do that so that it's out of the light, because it's not supposed to be in the light. So that's how I do it, so that it stays out of the light. Yeah, and now we're gonna inject it. So the fun stuff. So normally they tell you butt crack, booty crack. You want to stay horizontal of the top of the butt crack. So right here, and I normally go like right there. But you don't want to go too high, because you don't want to hit like a back vein. So like normally right there, right here. The way I see it, it's like where your bikini line is, kind of go on that, is the way that I kind of remember it. So if you are having someone else do it, with the cap on, you can mark where you want your injection site so that they know where to put it at. So if my husband was doing it, this is how I did it the other day. If my husband was doing it, I would mark where I wanted it. This is how I got it. So I would just mark it like this. With the cap on, you can mark it like you just press a little harder, and then it kind of leaves a circle. See, it kind of leaves an indentation like that, so that you know where you want your injection and where you want them to put the injection at. So that's how I do it. I always poke it a million times to make sure that's where I want it. So wipe it, pull the needle, make sure that a little drop comes out so that you know you got all the air bubbles. So a little drop come out like that, you see. So this is the part that like gives me a little bit of anxiety, because I'm like, so you pull back a little bit, make sure you're not in a vein. And then it's the part that takes forever. Just look at it to make sure none of the medicine is leaking out. And there you go.